Okay, President Trump has asked me to end the chronic disease epidemic and make America healthy again. And I'm
So
in a
is that the
unique
only reason
position.
why you're at HHS? Is that the
Excuse
only
me?
reason why then you're at the HHS to address that one issue?
President Trump has asked me because I'm in a unique position to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying, and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. Our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically, to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do.
Senator Barrasso.
Thanks so much, Mr. Chairman. Mr. Kennedy, thank you for taking time to visit with me in my office prior to today's hearing to talk about a lot of the important issues affecting healthcare in my home state of Wyoming, as well as the nation. I appreciate your willingness to serve our country. During our meeting, we discussed the challenges that healthcare providers and patients are facing in rural America, financial obstacles facing rural hospitals, workforce shortages, issues of OBGYN, and then new regulations that are painful that have come out of the Biden administration, hurting our ability to provide nursing home staffing. So let me start, if I could, with rural hospitals and the closures of hospitals like that. There are a lot of challenges facing hospitals in rural communities and frontier areas. We have 33 hospitals in Wyoming. 26 are really located in areas, locations, often hard to get to. Weather impacts them. 6 of the hospitals are at risk of closing. 2 are at immediate risk of closing in the next 2 years. 10 have had to cut available services. And this is a concern of rural hospitals in both Republican and Democrat states, either way, bipartisan. Critical that the workforce challenges, financial challenges that we're facing are addressed. Can you commit to working with us on a plan to address the critical nationwide issue of rural health care?
Yes, Senator. And I would say that during my visits, I visited almost 60 senators so far. And the most common unifying, I would say, issue among both Democrats and Republicans, there were 2. One was PBM reform, and the other is rural hospitals. And, you know, our nation made a commitment over 100 years ago to put up a hospital within 30 miles of every American. We generally succeeded in doing that. It's absolutely critical. It's life-saving. And rural hospitals are closing at an extraordinary rate right now. They not only provide important health care for the localities, but also they're economic drivers for localities all over this country. President Trump is determined to end the hemorrhage of rural hospitals, and he's asked me to do that through use of AI, through telemedicine, which these are innovations that I saw the other day. A Cleveland clinic has developed an AI nurse that you cannot distinguish from a human being, that has diagnostics as good as any doctor. And we can provide concierge care to every American in this country, even those, the remote parts of Wyoming, Montana, Alaska, et cetera. We also have opportunities at HRSA and at the GME to finally live up to GMA's mission of providing personnel to rural hospitals. And I intend to use all of my power, because I've seen the priority that is given by Democrats and Republicans on this committee. I intend to make that a priority if I'm privileged to be confirmed.
Well, I appreciate it, because often with financial strains on a local hospital, one of the common services to be cut in rural hospitals and maternity services. And now we have women in Wyoming having to drive over 100 miles to access care. 13 counties in Wyoming don't have access to OB. And we're talking counties larger than the states of Vermont, New Hampshire, Rhode Island, Connecticut, New Jersey, Delaware, counties larger than those whole states. So will you commit to working with my office to find solutions to help address these specific maternal health challenges in rural America?
Yes, Senator, I look forward to it.
Another issue we specifically spoke about with this harmful Biden administration rule that have really been bad for our rural nursing homes. And it's a rule that would triple the registered nurse requirements in nursing homes. This is going to lead, there just aren't enough registered nurses in our state to be able to comply with this. This would lead to nursing home closures across our state. Will you commit to working with me to fix this serious problem that it was a result of a rule that came out by the Biden administration, who clearly doesn't understand rural America?
Yes, Senator, I think the rule was well-intentioned, but as you've said, and I've heard from many rural senators, it will be a disaster for their states. Some of the nursing homes, these are staffing rules that require 24-hour staffing by medical professionals. Some of the nursing homes in rural areas simply do not have the available personnel or the economics to be able to do that. It will mean the closure of nursing homes in rural areas across our country, which means the parents, the elderly parent, will be moved a great distance from the local community and their family. And we know that the single greatest driver of high-quality nursing home care is the involvement, the proximity of family members. When you move that nursing facility away from the community where the kids live, you're going to get much worse care. So the intention, although it was noble, was in reality, for rural areas at least, it is going to be a disaster.
Thank you. Thank you, Mr. Chairman.
Thank you. Senator Johnson.
Mr. Kennedy, welcome. Thank you for being here. Thank you for your decades-long advocacy for a clean environment, for children's health. I can't say as I'm surprised by the hostility on the other side. I'm highly disappointed in it. I don't know if you remember when you called me up and you were contemplating setting your political differences aside, joining forces with President Trump on an area of agreement, addressing chronic illness, trying to find the root cause of all these problems facing this nation. And my first response was, Bobby, this is an answer to my prayers. We need to get to the answers of this, but even more, we need to heal and unify this divided nation. I'm not necessarily the most optimistic guy because we've got enormous challenges facing this nation, but I thought, wow, here's somebody from the left, somebody I don't agree with on many issues politically, coming together with President Trump and focusing on an area of agreement, something that the American people desperately want. Finding out the answers. What has caused autism? What is causing chronic illness? Ms. Kennedy, I think I've come to know what's in your heart. I think I know the personal and political price you've paid for this decision. I want to say publicly, I thank you for that. I truly appreciate what you're doing here. Can't we come together as a nation and do this? Can we do? Aren't you getting tired of this? I'm getting tired of this. So again, Mr. Kennedy, I need to enter in the record. These are just 11 letters of support signed by 63,000 people, thousands of doctors, From the Association of American Physicians and Surgeons, Independent Medical Alliance, the North Carolina Physicians and Freedom Group, Governor Jeff Landry from Louisiana. These are Americans, nonpartisan. A lot of these people, I know because I've advocated with you, a lot of them are Democrats. They put their political differences aside. So, Mr. Chairman, I'd like to enter this in the record.
Without objection.
I also do want to, Mr. Kennedy, as long as I have you here, I've written over 70 oversight letters to the federal health agencies under the Biden administration. I've virtually gotten squat out of them, okay? What I get is we get, for example, 50 pages of Anthony Fauci's emails redacted. Oh, by the way, the latest one was 17 pages. Instead of issuing a health alert on the myocarditis they knew was impacting young men early in 2021, instead of issuing an alert on the Health Alert Network, they developed 17 pages of talking points. This was given to the public under a FOIA request. They had to go to court. They've got a new way of redacting. They don't black things out. They just give you white pages, so you don't even know what they have redacted. So again, I've issued a subpoena now to cover the information I've requested in 70 oversight letters. My question to you is, as Secretary of HHS, will you honor these requests from Congress, and will you make HHS transparent?
Yeah, my approach to HHS, as I said before, Senator, is radical transparency. Democrats and Republicans ought to be able to come in and get information that was generated at taxpayer expense, that is owned by the American taxpayer. They shouldn't get redacted documents. Public health agencies should be transparent. And if we want Americans to restore trust in the public health agencies, we need transparency. I want to say something about what you first said. When I launched my campaign, it was about uniting Americans, Democrats and Republicans. There's no issue that should unite us more than this chronic health epidemic. There's no such thing as Republican children or Democratic children. These are our kids. 66% of them are damaged. I know what a healthy kid looks like, because I had so many of them in my family. I didn't know anybody with a food allergy growing up, peanut allergy. Why do 5 of my kids have allergies? Why are we seeing these explosions in diabetes, rheumatoid arthritis, neurological diseases, depression, all of these things that are related to toxics in the environment? Why can't we just agree with each other to put differences about so many issues, intractable issues aside, and say, we're going to end this? I don't think anybody is going to be able to do this like I have, because of my peculiar experience, because I've litigated against these agencies. When you litigate against them, you get a PhD in corporate capture and how to unravel it. I've written 6 books about these agencies. I know a lot about them, and I know how to fix it. And there's nobody who will fix it the way that I do, because I'm not scared of vested interests. I don't care. I'm not here because I want a position or a job. I have a very good life and a happy family. This is something I don't need. I want to do this because we're going to fix it. And the other thing is, we are attracting now a caliber of people to HHS like never before in history. And they're entrepreneurs, they're disruptors, they're innovators of immense talent that are walking away, many of them, from growing concerns. They're not coming there for position. They're coming there because they want to save our country. And they're from across the political spectrum. And all these Democrats are opposed to me for partisan issues. They used to be my friends, agreed with me on all the environmental issues that I've been working on for my whole career. Now they're against me because anything that President Trump does, any decision he makes, has to be lampooned, derided, discredited, marginalized, vilified.
We need to move on. Senator Warren.
Thank you, Mr. Chairman. So, Mr. Kennedy, I want to start with something that I think you and I agree on. and that Big Pharma has too much power in Washington. You said that President Trump asked you to, quote, clean up corruption and conflicts. Sounds great. You've said that you will, quote, slam shut the revolving door between government agencies and the companies they regulate. That also sounds great. So here's an easy question. Will you commit that when you leave this job, you will not accept compensation from a drug company, a medical device company, a hospital system, or a health insurer for at least 4 years, including as a lobbyist or a board member?
Can you just repeat the last part of the question? Can I commit
You're
to
not going
what?
to take money from drug companies in any way, shape, or form.
Who? Me?
Yes, you.
Oh, yeah, I'm
You're the
happy
one-
to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this
I don't
question.
think any of them want to give me money, by the way.
Right. Let's keep going. You're right, because to say yes, because every American has the right to know that every decision you make as our #1 health officer is to help them and not to make money for yourself in the future. So I want to talk more about money. I'm looking at your paperwork right now. In the past 2 years, you've raked in $2.5 million from a law firm called Wisner Baum. You go online, you do commercials to encourage people to sign up with Wisner Baum to join lawsuits against vaccine makers. And for everyone who signs up, you personally get paid. And if they win their case, you get 10% of what they win. So if you bring in somebody who gets $10 million, you walk away with $1 million. Now, you just said that you want the American people to know you can't be bought. Your decisions won't depend on how much money you could make in the future. You won't go to work for a drug company after you leave HHS. But you and I both know there's another way to make money. So, Mr. Kennedy, will you also agree that you won't take any compensation from any lawsuits against drug companies while you are secretary and for 4 years afterwards?
Well, I'll certainly commit to that while I'm secretary. But I do want to clarify something because you're making me sound like a shill. I put
You're the
together
one who
that
got-
case. I did the Science Day presentation to the judge on that case to get it into court, the
Mr.
Daubert
Kennedy,
hearing.
Mr. Kennedy, it's just a really simple question.
Yeah,
You've taken in $2.5 million. I want to know if you will commit right now that not only will you not go to work for drug companies, you won't go to work suing the drug companies and taking your rake out of that while you're a secretary and for 4 years after. It's just,
I'll commit to not taking any fees from drug companies while I'm secretary.
No. I'm asking about fees from suing drug companies. Will you agree not to do that?
You're asking me to not sue drug companies,
No,
and I'm not going to agree to
you can sue
that,
drug
Senator.
companies as much as you want.
I'm not going to agree to not sue drug companies or anybody.
So let's do a quick count here of how, as Secretary of HHS, if you get confirmed, you could influence every one of those lawsuits. Well, let me start the list. You could publish your anti-vaccine conspiracies, but this time on U.S. government letterhead, something a jury might be impressed by. You could appoint
I
people
don't
to
understand
the
that.
CDC vaccine panel who share your anti-vax views and let them do your dirty work. You could tell the CDC vaccine panel to remove a particular vaccine from the vaccine schedule. You could remove vaccines from special compensation programs, which would open up manufacturers to mass torts. You could make more injuries eligible for compensation even if there is no causal evidence. You could change vaccine court processes to make it easier to bring junk lawsuits. You could turn over FDA data to your friends at the law firm, and they could use it however it benefited them. You could change vaccine labeling. You could change vaccine information rules. You could change which claims are compensated in the vaccine injury compensation program. There's a lot of ways that you can influence those future lawsuits and pending lawsuits while you are Secretary of HHS. And I'm asking you to commit right now that you will not take a financial stake in every one of those lawsuits so that what you do as secretary will also benefit you financially down the line?
I'll comply with all the ethical guidelines.
That's not the question. You and I, you have said
You're asking me,
repeatedly,
Senator,
those
you're asking me not to sue
requirements are-
vaccine pharmaceutical
No, I am
companies.
not. My
Yeah, you
question
are.
is stop
That's exactly what
enriching
you're doing.
health. Look, no one should be fooled here. As
fought
Secretary
from-
of HHS, Robert Kennedy will have the power to undercut vaccines and vaccine manufacturing across our country. And for all of his talk about follow the science and his promise that he won't interfere with those of us who want to vaccinate his kids, the bottom line is the same. Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
How about then say you won't make money off what you do as Secretary of HHS?
Before we go to Senator Tillis, I think it would be important for me to make it very clear that Mr. Kennedy has gone through the same Office of Government Ethics process as every single other nominee in the Finance Committee this year and in previous administrations. In addition to listing his assets, including the items that you've identified, he has signed an ethics letter that has been reviewed by the Office of Government Ethics concerning any possible conflict in light of its functions and the nominee's proposed duties. And we have a letter from the Office of Government Ethics that he hasn't complied completely with all applicable laws and regulations governing conflicts of interest.
Mr. Chairman, point of information here. Have we had a single nominee come through who's made $2.5 million off suing one of the entities that it would be regulating and plans to keep getting a take of every lawsuit in the future? Have we had that before?
I haven't reviewed the past documentation of every other nominee's financial interests, and so no. But I know that every single time we get a nominee, their financial interests are attacked. That's why we have the Office of Government Ethics. That's why they've reviewed everything that's in his record, and that's why he has even, I think, and I don't know that I want him to get into it, but he has listed his assets and has gone through a discussion of the responsibilities under our ethics laws and has complied with all of those requirements. Senator Tillis.
Thank you, Mr. Chairman. Mr. Kennedy, how's your morning going?
So far, so good.
Good.
Senator.
You came prepared. I'm glad that you did. You, I believe, addressed to my satisfaction a question about Title X and the president's priority with respect to Planned Parenthood. Can you just affirm that you are 100% behind the president's policy on Title X and the implementation?
I'm 100% behind it, Senator.
Thank you. You know, it's amazing to me that people, well, first off, you need to understand I was in a judiciary hearing this morning. It's very clear to me that some of these nominations are going to be shirts and skins. So no matter what you answer in the affirmative, they're going to ask you one more question so that you won't be able to answer in the affirmative. That's just the way the game gets played when we have nominees like yourself. So I think you're handling yourself well. I got a real quick question for you. Are you a conspiracy theorist?
That is a pejorative, Senator, that's applied to me, mainly to keep me from asking difficult questions of powerful interests. I was told that I was a conspiracy theorist. That label was applied to me because I said that the vaccines, the COVID vaccine, didn't prevent transmission and it wouldn't prevent infection, when the government was telling people, Americans, that it would. I was saying that because I was looking at the monkey studies in May of 2020. I was called a conspiracy. Now everybody admits it. I was called a conspiracy theorist because I said red dye caused cancer. And now FDA has acknowledged that and banned it. I was called a conspiracy theorist because I said fluoride lowered IQ. Last week, JAMA published a meta-review of 87 studies saying that there's a direct inverse correlation between IQ loss.
All right, so I'm going to assume a
I could
lot of
go on
those-
for about a
so
week.
is there any one of them that you can say, you got me? That really was a conspiracy theory, or are you in a
Not yet.
position to submit for the record? I think it'd just be helpful for every one of these narratives for you to submit that maybe for the record. You said something about SNAP lunch. I was in the State House in North Carolina before I came here, and anytime I'd go visit an elementary school, the first thing I would do is go to the trash cans in the cafeteria. And what we have now are kids that are not eating the food because the dictates of the federal government have made it something that they don't want. But they say, well, it's a healthy alternative. It has processed materials in it, and it's not particularly attractive to them. So they throw it away. Trash cans full of food that these kids didn't eat. So then what do? They go eat snacks, or they go eat or they drink a sugared drink. The SNAP program, everything you've said about the SNAP program, I agree with. I think that we should be very, very strict about that, and it's going to make some people uncomfortable in the food manufacturing segment, produce healthy foods that we can put in the SNAP program. That's the way to address it. But we also need to look at the school health program. I was PTA president 22 years ago at my daughter's high school, and I feel like we've got these kids that need help. We've got to guide them through a process. Many of them are probably on Medicaid, and Medicaid's failing them. Everybody here says Medicaid is sacrosanct. Nobody's admitted that Medicaid is producing positive health outcomes. Is that your problem in Medicaid right now, the program or the outcomes?
Is the outcomes. We're spending $900 billion, and our people are getting sicker every single year.
Yeah, so
And
anybody who's
President Trump
building
wants people to have it, Americans to have high-quality insurance. That's what
Anybody
he's-
who's building a case for the status quo of Medicaid is by extension saying that they're happy with the outcomes. I think it's unacceptable. I do have a question for you on Project Warp Speed. We supported the CARES Act. We had 97 people in the U.S. Senate vote for it. Everybody here. There was only one member of Congress that voted against it, I believe. And Project Warp Speed had CDC, FDA, NIH, and BARDA very much in the mix. Now, some people think that you're going to come in here and insert yourself into those agencies in a way that's never been done before. Let's say that they're a part of a future Project Warp Speed. Is it your intent to go in and do something that's never been done before based on my staff's research and insert yourself in a discussion that the scientists are dealing with in those different agencies?
No, Senator, what I want to do is, I'm not a scientist. I want to empower scientists. I want to make sure that science is unobstructed by vested or economic interests.
That's good.
Or by bad culture. And I'll just say about Operation Warp Speed, it was an extraordinary accomplishment, demonstration of leadership by President Trump. When he promoted Operation Warp Speed, he was looking at all of the different remedies, including vaccines.
Therapeutics, everything.
Therapeutic, ivermectin, hydroxychloroquine, famotidine, even chlorine dioxide. And he was not looking at shutting down our country for the year, forcing people to wear masks for a year, forcing all social distancing that did not have any scientific base, which Dr. Fauci has now acknowledged. He said, we took it out of thin air. But all of those changed during the Biden administration. And it became very narrowly focused. We ended up with the worst, the highest death count of any country in the world.
Mr. Chair, if I can just ask one final question, and I think it's a one-word answer. I've heard a lot of people complaining about health care delivery, Medicaid, on the other side of the dais here. Who's been responsible for health care policies over the last 4 years?
The Biden administration.
I mean, the president, the Biden, okay.
Yeah.
So that, I'd like to have heard more of those in oversight hearings over the last 4 years. I haven't, but I'm glad that there's an acknowledgement that you're inheriting a problem that needs to be fixed. Thank you.
Thank you, Senator.
Senator Sanders.
Thank you, Mr. Chairman. Mr. Kennedy, thanks for being with us. I very much like the slogan that you coined, Make America Healthy Again. And I strongly agree with that effort. Despite spending, as you indicated, 2 or 3 times as much per capita on healthcare as other nations, We have 85 million people who are uninsured, underinsured. We have all kinds of chronic illnesses. Our life expectancy is lower than other countries. And for working class people in this country, they are living 6, 7 years shorter lives than the top 1%. We got a problem, okay? And I'm going to suggest some ideas that I think can remedy that. Last year, the insurance industry in this country made over $70 billion, while at the same time, 85 million Americans are uninsured or underinsured. Do you agree with me that the United States should join every other major country on earth and guarantee health care to all people as a human right? Yes? No?
Senator, I can't give you a yes or no answer to that question.
Health care a human right? Is health care a human right?
In the way that free speech is a human right,
Yeah.
I would say it's different, because if with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool. And so are you guaranteed the same right,
And if
or is there also a
look,
duty?
I'm sorry, I'd love to talk for an hour with you. We got a few minutes left here. All right. Every other country on earth says healthcare, whether you're poor or rich, young or old, is a human right. I'm not hearing you say that. All right, you've talked about the drug companies, and maybe we agree on this one. As you all know, despite the drug companies making over $100 billion in profits, paying CEOs outrageous compensation packages, we in some cases pay 10 times more for the same drug. Will you support legislation that I will introduce which says that in America we should not be paying a nickel more for prescription drugs than people around the rest of the world? Yes, no?
To equalize it,
Not to equalize it, that we should not be paying more than other countries for the same damn drug.
President Trump has asked me, in fact, I had a meeting with President Trump a week ago where we showed him the charts.
He knows the charts.
We're paying 10 times more from Europe.
That's right. And are you going to commit to us that you will end that absurdity?
I think in principle, we should end that disparity.
Good. Okay. That's great. All right. I happen to believe that climate change is real, it's an existential threat, and it is a healthcare issue. Donald Trump thinks that it is a hoax originating in China. Question is, in your judgment, is climate change a hoax, or is it real, causing devastating problems?
President Trump and I, from the beginning, from our first meeting, agreed to disagree on that issue. I believe climate change is existential. My job is to make Americans healthy again.
All right, you believe that,
that
you disagree with Trump, you don't think climate change is a hoax, is what I'm hearing.
my job here is to
I'm
make
just asking you that,
Americans
Mr. Kennedy, not a trick question.
healthy. I answered your question, Senator
Okay,
Sanders.
you disagree with the president on that.
I answered your question.
Okay. I'm going to pick up on a point that Senator Hassan made. Look, there is no question that abortion is a divisive issue in this country. I would say a majority of the people are pro-choice. There's a strong minority who are pro-life. A year and a half ago, you went to New Hampshire, running for president, gave a speech, and you talked about government should not tell a woman what she can do with her own body. That's her choice. Now, I think everybody on that side is pro-life. I think everybody here is pro-choice. I have never seen any major politician flip on that issue quite as quickly as you did when Trump asked you to become HHS secretary. Tell me why you think people should have confidence in your consistency and in your word when you really made a major U-turn on an issue of that importance in a short time.
Senator, I believe, and I've always believed, that every abortion is a tragedy.
But you told the people in New Hampshire that it was their right. All right, let me do a last question here because I'm running out of time. I think the gist of what you're trying to say today is you're really pro-vaccine, you want to ask questions. You have started a group called the Children's Health defense. You're the originator. Right now, as I understand it, on their website, they are selling what's called onesies. These are little things, clothing for babies. One of them is titled Unvaxxed, Unafraid. Next one, and they're sold for $26 a piece, by the way. Next one is No Vax, No Problem. Now, you're coming before this committee and you say you're pro-vaccine. Just want to ask some questions. And yet your organization is making money selling a child's product to parents for $26, which casts fundamental doubt on the usefulness of vaccines. Can you tell us now that you will, now that you are pro-vaccine, that you're going to have your organization take these products off the market?
Senator, I have no power over that organization. I'm not part of it. I resigned from the board.
Yeah, that was just a few months ago. You founded that. You certainly have power. You can make that call. Are you supportive of this?
I've had nothing to do with
Are you
leadership.
supportive of these onesies?
I'm supportive of vaccines.
Are you supportive of this clothing, which is militantly anti-vaccine?
I am supportive of vaccines. I will. I want good science, and I want to protect the
But you will
vaccine.
not tell the organization you founded not to continue selling that product. Thank you, Mr. Chairman.
Senator Blackburn.
Thank you so much, Mr. Chairman, and thank you so much for being with us today. And I have no doubt that you will be confirmed and you are going to do such a solid job for the people of this country. And I do have several issues I wanted to talk with you about and didn't have time to cover them all when we met prior to the meeting, but rural health care is very important to me and the people of Tennessee. 78 of our 95 counties are rural counties. Now, over the last few years, we've seen hospital closures. So we have focused on access in rural areas. And my rural health agenda, which is bipartisan, focuses on innovation, telehealth, access points. It focuses on work shortages, and also Senator Warner and I have together focused on making certain that we address the area wage index and do that fairly for our citizens that are in rural communities. So I would like a commitment from you that when confirmed, you and your CMS administrator will work with us to make certain that the area wage index is balanced and that it is fair to rural areas.
Senator, both Dr. Oz and myself recognize that rural health care is in crisis in this country, and that is catastrophic for our entire country. And I talked a little bit about my commitment to rural health earlier in this hearing. The regional price points, as you know, are set by Congress and not by HHS. I will certainly, and I know Dr. Oz will certainly work with you to make them sensible.
We look forward to that. Also, you and I, before you came forward as the secretary, the nominee, we had talked in years past about over-medicating youth and concerns over that. And I was looking at a report from TennCare, which is our Medicaid program in Tennessee. And I was concerned when I saw a number that TennCare had spent $90 million in 2024 alone on ADHD. This was 417,000 of our children. And $90 million, to me, that is heartbreaking, what is happening there. So how will you prioritize oversight of prescribing practices while promoting alternative solutions such as counseling, behavioral therapies, community-based interventions for our youth?
Exactly, and that's the solution. 15% of American youth are now on Adderall or some other ADHD medication. Even higher percentages are on SSRIs and benzos. We are not just over-medicating our children, we're over-medicating our entire population. half the pharmaceutical drugs on earth are now sold here. 70% of the profits from pharmaceutical companies are from the United States, even though we only have 4.2% of the world's population. Not only that, but a recent study by Cochrane Collaboration founder Peter Ghosh found that pharmaceutical drugs are the third largest cause of death in our country after heart attacks and cancers. Oh, they're not making us healthier. We need community health initiatives. We need access to treatment. We need exercise. We need better food.
Okay, let me talk to you about one of those access points in treatment. And this highlights a problem we have in the federal Medicaid law. Since Medicaid's enactment, states have been prohibited from using Medicaid funds for care provided by institutions for mental disease. We refer to them as IMDs. These are psychiatric hospitals, residential treatment facilities with more than 16 beds. This is a discriminatory exclusion, and it denies payment for medically necessary care based on the illness that is being treated, and it has perpetuated unequal coverage in mental health care. So if you're confirmed, when you're confirmed, will you commit to working with me on repealing this discriminatory exclusion and ensuring equal access to mental health care for Medicaid beneficiaries?
Yes, Senator.
Thank you so much. I've got a question on PBM reform, one on artificial intelligence in healthcare. In the interest of time, I will yield back. I look forward to seeing you help make us healthy again.
Thank you, Senator.
Senator Lujan.
What? No, you're next. I'm next.
Excuse me, I made a mistake. It's Senator Cantwell.
Thank you so much. Thank you, Mr. Chairman, and congratulations on your nomination, Mr. Kennedy. And I've been absent only because I've been in another hearing with the nominee to be the Commerce Secretary. So I will review everything that you've said today and look at that diligently. But one of the things that I wanted to discuss with you is I represent a very big innovation state. And innovation in healthcare specifically. Innovation like NIH funding to the Fred Hutch Cancer Center that helped develop the HPV vaccine, which has the potential to eliminate over 95% of cervical cancer. NIH also funds a lot of jobs and grants, nearly 11,000 people in the state of Washington and over $1.2 billion worth of grants. So while I agree with you on healthy foods, I definitely am troubled by the medical research side of innovation and some of the things that you have said. In fact, this issue about laying off 600 employees at NIH, or giving the fact that, to quote, give infectious disease a break for 8 years. So we've had a chance to talk about this a little bit. But the most striking example of this is when COVID hit. And we were the first in the nation. We had the first case, and it really was the fast response by the University of Washington that really helped save lives. So I just want to know that, are you aware of how harmful these issues could be for public health? That public health in and of itself could be affected by these kind of anti-science views?
Senator, I have always been a science person, a pro-science person. I believe in evidence-based medicine, in gold standard science. When I said, and I've explained this before you came in, that 600 people out of a population, out of a workforce of 91,000 is pretty typical. Last year alone, President Biden replaced 3,000 people at HHS and 700 at NIH. I want to say this. I said give infectious disease a break because that's been the principal preoccupation. Infectious disease Chronic disease is 92%, accounts for 92% of deaths in this country, and almost nothing is studied at NIH about the etiology of our chronic disease epidemic.
But right now.
The money is going to infectious disease.
But
And
I get your point. It's an interesting point. The problem is we had to respond. And it's actually the Gates Foundation and a flu cohort that figured out what was wrong and that we had an outbreak of COVID that was going beyond the very first case. And so we had to build a very fast response. So I take this too. The University of Washington has conducted groundbreaking stem cell research on fetal tissue. To me, I know there's probably a lot of people that may not agree with this, but we're making regenerative heart tissue now at the University of Washington. So yes or no, do you commit to protecting stem cell research for scientific agencies if confirmed?
I will protect stem cell research. Stem cell research today can be done on umbilical cords, and you don't need fetal tissue.
You'll protect the laws that are on the books today and the research that's done.
My job is, Senator, to enforce the laws.
Okay, so I want to move to PBMs because PBMs are driving up drug prices. And one of the biggest things that we need to do here, I think, in a new administration is get a handle on everything that is driving up prices and lower them. The report found that PBMs generated $1.4 billion from spread pricing. That is where they are able to basically set the price, not reimburse pharmacies, and then pocket the rest. We've had bipartisan legislation in several different committees now to get at this. What do you think the solution is?
I think one of the really notable achievements of this panel was the PBM legislation that they put together in a bipartisan way. I haven't met a single senator, well, actually one only, but of the 60-odd senators that I talked to, all of them talked about PBMs and how important it was. And President Trump, during his first administration, pushed through a law to give transparency to PBMs. It got overruled during the Biden administration. Luckily, this panel is resuscitating that. President Trump is absolutely committed to fixing the PBMs.
My time is running out, so I just want to clarify. You believe that we should pass these laws that now have been proposed in the Senate?
I haven't read the entire law, so I don't know, but I think that we need to reform the PBMs. I think we need
to
get rid of all of these vested interests that are draining money from the system.
Okay, somebody suggested, though, that you thought you should convene the PBMs and talk to them about some sort of self-regulation. So I am trying to distinguish between these people who basically are doing illegal activities and ripping off, really, they're creating pharmacy deserts in my state. So I'm asking you whether you believe that we have to legislate in this area.
Again, I'm not being evasive. I just don't know exactly what the law says. I met with the PBMs. I met with pharma. My job is to meet with all the stakeholders. I've been meeting with stakeholders for 40 years. People I was suing, people I was here from the other side.
Well,
that doesn't mean I would let the PBMs write their own ticket.
I think
I support the efforts of this committee to come up with bipartisan legislation. President Trump wants to get the excess profits away from the PBMs and send it back to primary care, to patients in this country, to high-quality health care.
I'll ask you for the record, since my time's expired, to look at the legislation that came out of the Commerce Committee that defines the legal activities that they are doing to drive up prices, and get us an answer for the record. Thank you, Mr. Chairman.
In principle, I support that legislation.
Thank you. And let me just tell you the list as we have to move forward to the ending here. Senator Lujan will be next, followed by Senator Marshall, Senator Warnock, Senator Smith, Senator Young, and Senator Welch.
And let me say again, Mr. Chairman, this is a matter of such importance. A number of my colleagues would like a second round, and I think it would be important to offer, say,
flooded with jobs.
What should consumers expect? Are prices going to go up short-term,
Well,
long-term?
not necessarily. I mean, not necessarily, but I'll tell you what will go up is jobs. The jobs will go up tremendously. We're going to have great jobs for everybody. This is something that should have been done many years ago. China did it. I mean, China did it at a level that probably nobody's ever seen before. If you manufactured a car, you couldn't send it into China. The tariff was so high, so everybody went and they built in China. It was no big secret. So we're going to see, but it's going to mean tremendous amounts of jobs. And ultimately, prices will stay the same, go down. But we're going to have a very dynamic country.
But if prices go up, Mr. President, because of these tariffs, who do you think voters should hold responsible?
Oh, I think what's going to go up is jobs are going to go up, and prices could go up somewhat short term, but prices will also go down. And I think the farmers are going to be helped by this very much because product is being dumped into our country, and our farmers are getting hurt very badly by the last administration. The last administration hated our farmers, like at a level that I've never seen before. I think our farmers are going to be helped. Jobs are going to be helped, but our farmers are going to be helped. Our manufacturers are going to be helped. And again, if somebody wants to come in, including the car companies, if they want to come in and build car plants, they'll do it without tariffs, and therefore prices won't go up. There could be some short-term disturbance, but long-term, it's gonna make our country a fortune.
So Americans should prepare for some short-term pain.
No, you said that. I didn't say that.
But if the prices go up.
Let's see what happens. Nobody really knows what is going to happen other than we know that jobs are going to be produced at levels that we haven't seen before. We know that we think interest rates are going to ultimately be coming down because of things that happen, and they go hand in hand with the tariffs. But we think that the prices for some things, many things, it could be all things, will go down. Ultimately, will go down.
Mr. President, can you explain the timeline here, sir? There's a period of time for a review, a report, 180 days. What's the earliest date that you think tariffs will actually be implemented in next?
Well, I would say, maybe I'll ask Howard to answer that, because he's going to be the one that's implementing. What do you think?
Our studies should be all complete by April 1st. So we'll hand the president the opportunity to start on April 2nd if he wants. So I think we'll be ready to go on April 1st, and we'll hand it to the president, and he'll make his decisions. But remember, if they drop their tariffs, prices for Americans are coming down. Our production's going up, and our costs are going down. Remember, it's a two-way street. That's why it's called reciprocal.
Have you spoken to any American CEOs directly about this? Or are they calling you and asking for
I've spoken to
exemptions?
many, and many love it. And they say this is going to be the thing that makes our country really prosperous again. And this is going to be what pays down to $36 trillion in debt and all the other things. And this is going to be, this is an amazing day. I think this is going to be a very big day and in a very positive way for our country. Yes, please.
Mr. President, you've talked about the VAT and the EU before and your concerns with how the EU treats you. Do you have a number in mind on the European Union? Do you have an idea of where that number is going to land?
Well, what they are now is they have a 20% VAT tax, which we're considering to be similar or the same as the tariff. Plus, they charge lots of fees, and you know they're doing something else. European Union's been very tough on our companies. They sued Apple, they sued Google, they sued Facebook, they sued many other companies, and they're American companies, and the kind of numbers are staggering. And the court system over there is not very good to our companies. If you know that Apple had to pay, I think, $16 billion in a penalty, a court case that was really shocking because most people thought they would have won that court case, people that watched it. So they've been very tough. Airlines have called me up and they said, could you help us with Europe because they're charging us so many different fees. I got a call from the head of American, United, and other airlines saying, every time we land a plane, we get just absolutely killed by the European Union. And so they haven't been treated as good. You know, we think the European Union is wonderful. We all love Europe, love the countries in Europe, but European Union has been absolutely brutal on trade. Canada's been very bad to us on trade, but now Canada's going to have to start paying up. And Canada's been tough on the military because they have a very low military cost. They think we're going to, you know, protect them with our military, which is unfair. So Canada's going to be a very interesting situation because, you know, we just don't need their product. And yet they survive off the fact that we do 95% of what they do. And Canada is just absolutely, I say it, and sometimes people smile and sometimes they say great idea, but Canada, their taxes would come down greatly, their security would go up greatly. Amazing things happen to Canada, and really Canada in this particular, why would we pay $200 billion a year in subsidies to Canada when they're not a state? You do that for a state, but you don't do that for somebody else's country. So I think Canada is going to be a very serious contender to be our 51st state.
Negotiations going with Canada. There was obviously a delay in implementing those tariffs.
I spoke to Governor Trudeau on numerous occasions, and we'll see what happens. But it just sets up so good for them. Look, the people would pay much less tax than they're paying right now. They'd have perfect military protection. They don't have any military protection because and you take a look at what's going on out there. You have Russian ships, you have China ships, you have Chinese ships, you have a lot of ships out there, and you know, people are in danger. This is a different world today. It's a different world. They need our protection, yes.
You mentioned Elon Musk and the efforts that he's undertaking with your
Yeah.
authority. You granted him new authority this week. Will he have any new government contracts while he is working on DOGE?
No, not if there's a conflict. If there's no conflict, I guess what difference does it make? But we won't let him do anything having to do with the conflict.
Are you personally checking to make sure there's no conflicts of interest?
Yeah, I am.
He answers to you.
Sure, he does. First of all, he wouldn't do it. And second of all, we're not going to let him do anything with there's a conflict of interest.
Mr. President, your negotiations with the EU are there's discussions ongoing already. How quickly do you expect that you'll hear back from them about any of these other measures?
I can't tell you, yeah. The EU's been very nasty. It's just been, they haven't treated us properly. Look, we were great to them on NATO. Essentially, it's a similar group of countries. When I came in, my first term, I raised their fees. I mean, they were not paying. We were paying for, in my opinion, almost all of NATO. And now, you know, I had the bad moment with the press where the press said, well, does this mean you won't protect them? And I said, I won't protect them if they're not paying. But because I said that, the Secretary General, as you know, said it was the greatest thing he's ever seen because the money came pouring in. But they don't treat us right on trade. They don't treat us right on the military either. I mean, if you look at Ukraine, we're in for probably $200 billion more than Europe. Why are we in for more than Europe? We're in for more than Europe. I mean, think of it, or NATO. I mean, let's call it NATO because Canada's in. By the way, Canada is just about the lowest payer. Also, they shouldn't be. They are just about the lowest payer in NATO, in addition to everything else. So Canada's really been taken advantage of. And if they had to pay just something modestly fair, they wouldn't be able to succeed as a country. And that's why I feel they have to become a state. Yes, ma'am.
Mr. President, is it your expectation that partners will offer major concessions and that you actually don't end up applying those tariffs?
No, I think that a lot of them will stay the same, and whatever they pay, I'll pay. I mean, we'll have a lot of them stay the same. I think some, look, I heard as an example, EU lowered their tax on cars down to the exact same amount that they were much higher. They were approximately 5 times higher, and they lowered them down to the exact tax that we're charging. That took place like yesterday or the day before. Is that a correct statement? I think so, yeah.
Do you expect any exemptions or waivers?
I don't expect that, no. This is a simple system. I mean, there wouldn't be any. And in the case of Apple, I gave them a waiver, an exemption in my first term because Samsung was in South Korea. And Samsung didn't have to pay the tax because it was a tax on China. And Apple makes a lot of their product in China. So I did that because it wouldn't have been fair. But now this applies to everybody across the board. This is a much simpler way of doing it, much better way.
You had that major call yesterday with President Putin of
Yeah.
Russia. President Zelensky responded today basically saying any agreements they won't accept unless they're made with Ukraine. Will Ukraine have a seat at that table for those negotiations?
Of course they would. I mean, they're part of it. We would have Ukraine, we'd have Russia, and we'll have other people involved too. A lot of people, a lot of forks in the a lot of forks in this game, I'll tell you what. This is a very interesting situation, but the Ukraine war has to end. The young people are being killed at levels that nobody's seen since World War II, and it's a ridiculous war, and it has to end. We had a good talk with President Putin. I had a good talk with President Zelensky, very good talk. And somebody said, oh, I should have called Zelensky first. I don't think so. I mean, we have to find out whether or not Russia wants to make a deal. I know that Zelensky wants to make a deal because he told me that, but I now know that Russia wants to make a deal.
Did you ask Secretary Hegseth to walk back his comments yesterday saying Ukraine won't join NATO and won't go back to pre-2014 borders because those are bargaining chips you could use?
No, I didn't. Somebody told me to, but I thought his comments were good yesterday, and they're probably good today. They're a little bit softer, perhaps, but I thought his comments from yesterday. I thought his comments yesterday were pretty accurate. I don't see any way that a country in Russia's position could allow them, just in their position, could allow them to join NATO. I don't see that happening. And long before President Putin, Russia was very strong on the fact that, I believe that's the reason the war started, because Biden went out and said that they could join NATO, and he shouldn't have said that. As soon as he said that, I said, you know what? You're going to have a war now, and I was right about that. This is a war that would have never happened if I were president.
You don't think it's President Biden's fault, not President Putin? I mean, he's the one.
I think Biden is incompetent, and I think when he said that they could join NATO, I thought that was a very stupid thing to say. I thought when he said, well, it depends if it's a minor incursion. In other words, it's okay if Russia does a minor incursion. I thought that was a very foolish thing to say. The other thing that got it started was how badly Milley and these stupid people, bad generals, how badly they did with Afghanistan. I was going to pull out, but we were pulling out with dignity and strength, and we were going to take our equipment with us and everything else. They are, I mean, what they're doing is, what they did with that, I think Putin looked at that mess and he said, wow, this is a great time, I'm going to go in. But what the Americans said, I'm not blaming Americans, but I will say what they said had a big influence on his deciding to go in. Yeah.
When Elon Musk met with Prime Minister Modi earlier today, did he do so as an American CEO or did he do so as a representative of the U.S. government?
Are you talking about me?
No, Elon Musk.
Elon, I don't know. They met, and I assume he wants to do business in India. But India is a very hard place to do business in because of the tariffs. They have the highest tariffs just about in the world, and it's a hard place to do business. No, I would imagine he met possibly because, you know, he's running a company. He's doing this as something that he's felt strongly about for a long time because he sees what's happening, and he sees how the country is really being hurt badly by all of the fraud, waste, and abuse. Yeah.
So how does Modi know whether he's meeting with a CEO or meeting with a representative of your government?
Well, he's meeting with me in a little while, so I'm going to ask him that question. All right? I'll ask him that question. Yeah.
On auto tariffs, what should we expect, sir? You mentioned obviously steel and aluminum and pharmaceuticals. What are you thinking about auto tariffs? We haven't talked about that much.
I think autos are coming soon. I think they're all coming more or less at the same time. And it's not going to be a big shock to the system. But what it's going to do is it's going to bring pharmaceuticals back to our country. Much more important than the money. It's a lot of money, but it's going to bring pharmaceuticals back to our country. It's going to bring chips back to our country. It's going to bring automobile. We're going to do a lot more automobile manufacturing in our country. You know, when I did this, when I announced this during the campaign, they were going to build the largest car plant in the world in Mexico. It was almost under construction. It was just starting. And when they heard me make that statement, and they thought I was going to win the election, actually, it was a few months before the election itself. China was building the car plant. It was the largest in the world. They immediately stopped construction. You can see the foundations there. They immediately stopped. When they heard I was doing this, that would have destroyed Detroit. It would have destroyed Michigan. This plant would have taken up more than almost the whole state built. And it would have been very destructive. When they heard me speak, and they said, wow, if he gets in, we're gonna lose our shirt. So they stopped building. That's the impact that tariffs have. Again, you know, I say it, and I say it loudly. It's the most beautiful word, but now I say religion, love, and a couple of other things are more beautiful because I got in a lot of problem with the fake news when they said oh, other things are more important. God is more important, but these are the words. But I would say it's number 4 or 5. To me, it's the most beautiful. And I'll tell you what, I think really reciprocal tariffs, those 2 words, reciprocal makes tariffs really fair.
There'd be no exemptions, right? It would be all auto imports?
Any exemptions now, because you don't need to. With reciprocal, you don't need to.
Mr. President, Gavin Clegg just arrived at the IRS.
Fox Radio. Do you have a update on the TikTok negotiations? And
Yeah,
kind of-
we have a lot of people.
Timeline's running out, isn't it?
Sure, well, I have 90 days from about 2 weeks ago, right? And I'm sure it can be extended, but let's see, I don't think you'll need to. We have a lot of people interested in TikTok, and I hope to be able to make a deal. I think it would be good. You know, people have learned it's very popular, and we'll have to probably get approval from China to do it, but we have a lot of people that are interested, and a lot of people, I think China will be interested because it's to their benefit too. So I look forward to that, but we have a lot of people that are interested in TikTok, quite a few.
Mr. President, Doge workers arrived today, Gavin Clegg and others arrived today at the IRS. Do you expect to close the IRS, or what are you expecting?
No, I don't expect it, but I think that the Internal Revenue Service will be looked at like everybody else. Just about everybody's going to be looked at. So it's they're doing a hell of a job. It's an amazing job they're doing. And you know, that force is building these, I call it the force of super geniuses, but it's building. And you know, they go up and they talk to some of the people about certain deals, and the people get all tongue-tied. They can't talk because these people get it. They're very smart people. We need smart people. Yes. Brian?
On tariffs, sir.
Yeah, Brian?
Yes, sir. Mr. President, I know that during the campaign, it was huge in Pennsylvania as far as bringing back manufacturing. Have we talked to any CEOs since the tariffs were announced on steel and aluminum? What's the feedback from those?
They are in love with it. As you know, in Pennsylvania, U.S. Steel is through the roof. They're all through the roof. That's why I didn't want U.S. Steel to make a deal with Japan or anybody else. I think it's going to do great. But I think maybe more than anybody else, the steel companies and aluminum companies, they're in love with what's happened. And this will eventually be the car companies and chip companies. We have to have chips made in this country. Right now, everything's made in Taiwan practically, almost all of it, a little bit in South Korea. But everything, almost all of it is made in Taiwan. And we want it to be made. We want those companies to come to our country, in all due respect. You know, they took the business away. Taiwan took our chip business away. We had Intel, we had these great companies that did so well, and it was taken from us, and we want that business back. We want it back in the United States, and if they don't bring it back, we're not going to be very happy.
You
Sir, on
mentioned
tariffs, are you-
pharmaceuticals as well in China. That's national security to bring that back.
Yeah, China and other places. We want to get the pharmaceutical and drug business back into the United States, where it should be. Right?
Sir, on tariffs, are you concerned that the countries that would be most affected, like India, would just shift their trading to China?
No, I'm not concerned about anything, really. I mean, I'm just doing what's fair. This is a very fair thing. This should have been done a long time ago. I would have done it, but then COVID hit. I was getting ready to do this years ago, and first time we had the most successful economy in history, and then COVID hit, and this was going to be the thing that I was most waiting to do, but it was awfully hard to do this with Italy and France and Spain, and all those people were dying, and then we put tariffs on. See, I have a big heart.
Sir, on Ukraine, when Putin says that he really wants peace, do you believe him?
Yeah, I do. I believe he wants peace. I believe that President Putin, when I spoke to him yesterday, I mean, I know him very well. Yeah, I think he wants peace. I think he would tell me if he didn't. I'd like to see peace.
Do you trust President Putin?
I believe that, I believe that he would like to see something happen. I trust him on this subject. I think he'd like to see something happen. I think it could have happened a long time ago. I think Biden, number one, it shouldn't have started, but it did. And now all those cities are knocked down, like demolition sites. All those beautiful golden towers are knocked down. There's nothing going to replace them. But much more importantly, you lost millions of people. A lot of soldiers, but you lost millions of people. When they knocked down those cities, and they're all laying down on the side, they're lying down just in ashes and all crumbled up concrete. They literally look like a world-class demolition site. And many of them, almost all of them, but many of them, and this should have been done by Biden years ago. This should have never been allowed to happen. I know he's a friend of yours.
But couldn't Putin just withdraw his
It's a
today?
CNN. That's why nobody watches CNN anymore, because they have no credibility. Okay, who else? Yes, please.
Sir, if you can find a buyer in the United States for TikTok, do you think Xi Jinping will authorize the sale of it, or will he?
I'm going to make it worthwhile for China to do it. I think so. I mean, I got to know TikTok because during the election, I ended up with 36% higher than my opponent with youth. Okay, that never happened before. I mean, you know, that's always been a Democrat thing, youth. It became a Trump thing. And I think TikTok, I think Joe Rogan was a part of it. Some of the great people that I did interviews with were a part of it. But I think that TikTok was I think it was a big part. Look, as you know, we were up by 36% with youth. The Republican was never up with youth. And I focused on TikTok, and I found it to be amazing, actually, and very fair. And I think the image of TikTok is different than it was before the election. I think people saw it and they view it as a positive, not a negative. I think it'll be to China's advantage to have the deal be made, yeah.
How much money do you think you'll raise from tariffs on an annual basis?
That's the most interesting question. I think it'll be a staggering amount. It will be the external, I call it the External Revenue Service. That was a name that was devised by a few of us, but I think it's going to be a staggering amount.
We've heard the number 1 trillion floated in meetings with senators. Is that a number you've thought of?
I don't know, but already the Senate's saying, well, wait a minute, you know, they're looking at some of the numbers and they're saying, whoa, this is, look, we want to, I say America first, I say make America great again. That's what we're doing. This is, I think it's the most important thing I've signed. I've signed some very important things. Right to try was so important. I mean, a lot of important things. Space Force, the biggest tax, you know, this could be one of the most important things that we've ever signed.
Do you expect the Russians and President Putin to attend the summit in Saudi Arabia?
Eventually, yeah. Not quite yet. It's a little early. They're having a meeting in Munich tomorrow. Russia is going to be there with our people. Ukraine is also invited, by the way. Not sure exactly who's going to be there from any country, but high-level people from Russia, from Ukraine, and from the United States.
Do you want to have Russia back to the G7, sir?
I'd love to have them back. I think it was a mistake to throw them out. Look, it's not a question of liking Russia or not liking Russia. It was the G8. And you know, I said, what are you doing? You guys, all you talk about is Russia, and they should be sitting at the table. I think Putin would love to be back. Obama and a couple of other people made a mistake and they got Russia out. It's very possible that if that was the G8, you wouldn't have had the problem with Ukraine. And if I was president, you definitely wouldn't have had the problem with Ukraine. Russia would have never attacked Ukraine. But you ask a very good question, the G8. It used to be the G8 and then these people threw them out. And I was arguing with Trudeau and with numerous of the people. Actually, Prime Minister Abe, a great man from Japan, agreed with me 100%, and some of the others did too. But I got there, it was the G7, as you know. They had already been terminated. I think it would have been very helpful, and it still would be helpful to have Russia be a part of that mix. And I think if they were, I don't think you would have had the problem that you have right now.
Russia
is part of the G20.
They kicked them out, of course, because they illegally annexed Crimea. I mean, how would you have responded if Russia invaded or took over?
They took Crimea during Obama. They took, now they're looking to take the whole thing. Then they took a big chunk of land and people, as you know, during Bush. And now they're trying to take the whole thing during Biden. You know, the only one that didn't give them anything is Trump. They never took anything with Trump, nothing, not 2 inches of property of land. But
All right, mi gente. I have just learned that Robert F. Kennedy Jr. has been sworn in. Stand by. I'm going to see if I can pull up that footage. My gosh, this is as of 12 minutes ago, and it was posted by Margot Martin, and Chief Nerd just reposted it. So stand by, and let me go and share the screen. So apologies. I thought that we would witness this moment. I mean, look.
On which I'm about to enter, so help me God. So help me God. Congratulations, Mr. Secretary. On which I'm about to enter, so help me God.
Okay, so it's official, guys. We missed it. It did happen at 2 o'clock. We thought it was gonna happen live, pero I'm trying to see if there's vamos a ver if I could find a bigger clip. Esperando todo este tiempo, and they weren't even live with it. ¿Y por qué no? Look at this.
Kennedy Jr. I, Robert F. Kennedy Jr. Do solemnly swear. Do solemnly swear.
Let's get this official. Hold on.
I, Robert F. Kennedy Jr. I, Robert F. Kennedy Jr. Do solemnly swear. Do solemnly swear. That I will support and defend. That I will support and defend. The Constitution of the United States. The Constitution of the United States. Against all enemies. Against all enemies. Foreign and domestic. Foreign and domestic. That I will bear true faith and allegiance to the same. That I will bear true faith and allegiance to the same. That I take this obligation freely. I take this obligation freely. Without any mental reservation. Without any mental reservation. Or purpose of evasion. Or purpose of evasion. And that I will well and faithfully discharge. And that I will well and faithfully discharge. The duties of the office. The duties of the office. On which I am about to enter. On which I'm about to enter. So help me God. So help me God. Congratulations, Mr. Secretary.
Congratulations, RFK Jr. Sorry, guys, it wasn't live. I don't know why they didn't share that with us, but we're still here for the historical day. And congratulations on this historic win. Congratulations to the medical freedom movement. And wow. I'm disappointed we didn't get to see that part live. Thank you for everyone that was hanging out with us. Y congratulations once again, RFK. It feels really good to be in this moment, to be honest. And thank you, all of you, for standing by. I wanted to share just go down the Cafecito Break Twitter timeline to share some moments that I appreciate. So, 1 second. I'm still learning my way around. Okay, let me go back. So this is the Twitter. This is Cafecito Break on X. Okay.
But this is what happens when you censor somebody for 18 years. I got a lot to talk about. They shouldn't have shut me up that long, because now I'm going to really let loose on them for the next 18 months. They're going to hear a lot from me.
And now we're going to hear so much more. All the MAHA moms. Ay, Dios mío, that was funny. Another victory RFK Jr. has been confirmed HHS Secretary in another victory. I want to read something. Going back to the timeline. Oh my God, this is a moment that my sister and I witnessed in Philly. Let me share it. So, so this was a moment we didn't expect, and this is Kyle Kemper with Robert F. Kennedy Jr. And Kyle is the half brother of Justin Trudeau, and this is video that we took, my sister and I took, in a very private setting the day that Robert F. Kennedy Jr. declared his independence officially. And let's play the video.
The remedy, known as Kennedy, has just declared independence, and you're all invited to declare independence as well. That is the only time.
Ay, Dios mío.
There you go. So, as luck would have it, a few months ago, well, late last year, I had the opportunity to work on Rescue the Republic in DC. And the day after the event wrapped up, and going to the hotel area to get some coffee, I struck up a conversation. I spotted Kyle and I struck up a conversation, and I shared with him that my sister and I had been in the room that day where he walked in, and Kennedy lit up as soon as he walked in, and they gave each other like the biggest embrace. So, for example, this, Kyle picked him up and then Kennedy followed by picking him up. And, it was really lovely to have shared that moment with Kyle. He was very gracious. I asked him if he wanted the pictures and the little clip that my sister and I had taken of that moment. And that was followed by an opportunity in which I was able to interview Kyle, and I'll be sharing that interview really soon. So really, this day means a lot to us, and we are incredibly grateful for the opportunities in which we had in proximity to Kennedy, in proximity to the people who work so closely, for the opportunities of supporting Children's Health Defense and Autism Action Network and Teachers for Choice, and all the medical freedom warriors in New York, the Lions in New York, the attorneys, so many powerful attorneys. I mean, I sit here and I can think of so many names, and I should have been prepared like Michael Caine was, who was ready with his beautiful thank you message that I'd like to read to you guys. So, look, this is us, the first time that we met Robert F. Kennedy Jr. And this was at a Brooklyn event. So I posted as soon as he got confirmed. It feels like New Year's. Congratulations, Robert F. Kennedy Jr. That's my sister Alex. And let's go back. And this was when it was shared by the New York Post. My little congratulations. Now, this is Michael Caine of Teachers for Choice. He on Children's Health Defense TV, which is an org that Robert F. Kennedy was intimately involved with up until the time, of course, that he made the decision to run for president. So I'd like to read this beautiful sentiment by Teachers for Choice, Robert F. Kennedy Jr., as I wrap out today's. Okay, This is from Michael Caine. Robert F. Kennedy Jr. is now officially the U.S. Secretary of Health and Human Services. So many people to praise and thank. Today, Robert F. Kennedy Jr. has been confirmed by the Senate as the 20th Secretary of Health and Human Services. Congratulations, Mr. Secretary. This amazing moment is the culmination of years, even decades of work from so many. The work of parents of injured children, adults who were injured, parents who opposed school closures, citizens who opposed lockdowns, workers who refused forced medical procedures, honest scientists with integrity, organic natural food advocates, and all of us who have opposed the great poisoning of our land, air, water, bodies, and children. I want to congratulate Robert F. Kennedy Jr. on this historic accomplishment and thank him for always being a true warrior for medical and health freedom. When I was fired as a special education teacher in New York City for declining the COVID shot, only Robert F. Kennedy Jr. immediately stood up to back up lawsuits helping me and so many others. Those lawsuits continue to this day, backed by the organization Kennedy founded, Children's Health Defense. I have so many people to thank for playing their role in making this day happen. So these are his thank yous. I'm going to read the list. I want to personally thank Children's Health Defense, American Values, Autism Action Network, Bravest for Choice, Teachers for Choice, Mary Holland, Sujata Gibson, John Gilmore, Mark Gordon, Tony Lyons, Candace McDonald, Dr. J. Bhattacharya, Leigh Marinoff, Tremel Thompson, Jamel Holly, Kristen Elizabeth, Wendy, Leland Lehrman, Deborah Sheldon, Naomi Wolf, Dr. Merrill Nass, Dr. Pierre Corey, Dr. Asim Malhotra, Ed Dowd, Kevin Nathaniel and the Spirit Drummers, Polly Tomei, Andy Wakefield, Sue Peters, Sayer G, Leah Wilson, Sheila Ely, rest in peace, Dr. Aaron Chiarati, Dr. Ryan Cole, Jeffrey Tucker, Paul Thacker, Amanda Damian, Matt Toon, Rebecca Muganis, Nurse Angela, Giorgio Zioella, Craig Makohus, apologies for mispronouncing names, Trisha Lindsay, Bobby Ann Cox, Charlie Lyons, Liam Sturgis, Matt Connor, Sophie Medina, Paul Schwitt, Brendan Fogarty, Tom Lapola, John McCary, Marlon Bethel, Rachel Maniscalco, John Matlin, Cara Castronova, Christina Martinez, Jimmy Wagner, Larry Sharp, Stephanie Spear, Melissa Bordez, Laura Bono, Stephanie Locriccio, Sarah Bacon, Ray Flores, Del Bigtree, Stephen Kirsch, Dr. Peter McCullough, Dr. Robert Malone, Cozy 19, DVS, Curtis Cost, Rita Palmer, Bonnie Scala, Clitta Didis, Dion Powell, Gary Knoll, Tom Dance, Sue Ironfield, Rick Potter, Diane Atkins, MC Armstrong, Nikos Biggs, Cairo Palos, Kyle Hentz, Kyle Warner, Trinidad Smith, William Castro, Jeffrey Rose, Holden Coulada, Rosangel and Alex Perez of Cafecito Break, Kevin Connery, Ellen Clare, Fred Bailey, William Riley, Davis Yantz, Zen Honeycutt, Diane Pajan, Ora Moody, Natalia Murakierer, Maud Myron, Anthony Block, Dennison Joyce, Garrett Ramirez, Mo Oliver, Online Borno, Rob Ribick, Peter Otto, Diana Wilson, Garrett Charamonti, Joanne Ariola, Vicky Palladino, Jennifer, Stella, Michael continues. I'm sure I've missed many. And he goes on to say special thanks to the American values and mighty American strike force who I helped bring together an historic MAHA partnership to get Kennedy volunteers into Pennsylvania canvassing and knocking on doors for Trump. Our efforts played a major role in flipping Bucks County for the first time since 1988, helping to assure Trump won PA. And my biggest thanks goes to New York grassroots Kennedy supporters who knocked doors in PA, who got signatures for Bobby on the ballot in New York, who rallied in the streets, at the courthouses in Albany and New York City, went to D.C. for Kennedy's confirmation hearings, and who were the fire in the engine for so much that went down, including for me personally. And he continues to say his thank yous. I just, I want to read one of the last lines that he has. You know, when it's always important to thank family, because I have to say that those of us who have been so focused day in and day out, our families have had to tolerate a lot, because it hasn't been easy to tolerate those of us to be a container of that amazing space, because many of us felt without a doubt that we needed to go and move forward and continue to raise awareness, and people did what they felt called to do, what God put in their hearts. And I want to take this opportunity to also thank my families for the space that they held, for all the times that they were nervous for my sister and I, and whatever we went to cover, or any of the efforts that we participated in, that just kept creating what seemed to be a further divide in humans, in relationships between colleagues and polite society. But we never wavered, because we knew what Mr. Kennedy knew, what many people, many OG folks have known for decades, that what was happening in 2020 and many things that happened before then were not right, they were wrong. And 2020, I guess, was a marker where many of us were like, no más, no más, no más. We can't get worse than what we are seeing, when we see a global standstill, a lockstep of sorts that took away a lot of our freedoms and divided humans, and we're still recovering from those days, not to mention all the people that have passed. This day, February 13th, 2025, I'm marking it as a day that we begin our journey, and as we, I mean a collective we, towards healing, towards living a more holistic journey. So Michael concludes, I can't help but celebrate this one like it's my own personal victory. I hear you, Michael. I feel the same way. It feels like New Year's, right? He says, it just means so much to me. I have been working to get Bobby in the White House since spring of 2023, and here we are now. Please indulge me, and please forgive the indulgence. No forgiveness needed. He goes on to say, I want to thank my parents, Dennis and Ann Kane, for all they have done for me and my children. My father, who taught me to question, who handed me the book, This Perfect Day by Ira Levin, when I was just 12 years old. My mother, who has always loved me unconditionally, even at times I hardly deserved it. They raised me to be the man who said no when they came for the teachers. And I know that when I was fired for declining the shop, wow, I'm getting emotional, and just moved into the first house with my wife and children, they were scared as I was. But it's really all their fault for raising me with values, morals, and principles. And to my wife, Jessica, thank you for tolerating my insanity and my passion. I love you and the boys eternally. now the work really begins to make America healthy again. And I'm tearing up because it's starting to hit me. I mean, it's just been nonstop, nonstop, nonstop in so many ways. And this is a good moment in history. Let me just remind you of what this looked like optically. This is not my video, though. I just want to point. My gosh, seeing these moments is like, it really does feel like we collided into a parallel Earth, because que jodienda was that all about? Let's go down to the MAHA line on Trending X a ver si hay más. Yo todavía no puedo creer que nosotros no perdimos. I can't believe that we didn't see this live. My gosh. All the MAHA moms. Yep. It's amazing. I want to travel to, I'm going to take you guys to Cafecito Break on YouTube. Stand by. I'm going to stop sharing the screen for a moment. Let me put this picture and let's go visit on YouTube. See what I can find on YouTube. My gosh. All right, guys. Doing this live. Let me see. All right. So I am going to share with you that we went, medical freedom activists, Michael Caine, Teachers for Choice, and John Gilmore of Autism Action Network, and OG Warriors. We went to DC to support RFK during one of his days in the confirmation hearing. So let me share that video with you.
We made it. We are here in DC for the RFK Jr. HHS confirmation hearing. They are hopefully going to confirm him for Secretary of Human and Health Services, and we need that man in office. This is Rosangel Perez, one of the paresses of Cafecito Break, feeling like we are here on another leg of our journey. It's graduation day. It almost feels like it could be New Year's, but it'll be New Year's when we find out, when we learn 100% that he's been confirmed. And I'm here with my sister Alex. Say hi, Alex.
Hola, hola, hola. And I'm just feeling exactly what she just said. Excited, a little anxious. It feels very historical today.
Can you even believe that we're here in DC? Neither can I. I feel so excited. I don't know. Well, I get a feeling they're listening to the confirmation hearing. Ladies, how's it going?
Praying that the right thing happens, that RFK gets confirmed. We need him.
Tell me your name and where are you joining us from?
I'm from North Carolina. I'm an RN of 45 years, and I've seen all the chronic illness, autism. Things have to change in America. We need change. We need change in our food, big pharma, the environment, all of it is poisoning our children and adults.
Pam, what was a turning moment for you when you were like, ja, enough is enough?
The turning point was when my 6-year-old daughter was born, and they wanted to give her a hepatitis B vaccine the day of birth. And my daughter refused, of course, and I started researching vaccines. Even though I was a nurse, I just accepted vaccines as being good. But once I've researched them, I found RFK and a lot of doctors. I learned a lot, and I've learned that there is danger in any vaccine. And then I started researching food, and I found out our food is very toxic. It's making people sick.
Isn't that a shame? We are a country of so much wealth, so much prosperity, so much intelligence, and this is where we're at with our diet, with our health system. Tell me your name and what are your thoughts about this?
Hill, and something very interesting. I do have a grandson who has autism, but I spent a lot of time in Argentina, and I was just down there in July for 3 weeks, and they have a lot of turbo cancers right now from the COVID. They were forced to take the COVID vaccine. I could tell you many horror stories, but also they used to have a very low rate of autism. The rate of autism has shot up since they have adopted the methods of doing the vaccines. They used to do one at a time. I know that because my daughter lived down there and had her children down there, and they would do one at a time, and they had very low rates. Now they do our system of vaccines where they just pile them on. The autism rate has shot up. So I already was suspicious, but I don't know. I'm not a scientist, but it just is very suspicious. But just seeing what I saw this summer in Argentina with dear friends and working with children down there, plus having an autistic grandson, it makes me very concerned about the whole vaccine program and what we do to our children, and the fact that you cannot even question it here in this country. You're not even allowed to question it. So,
yeah, isn't that alarming? That's when you start even questioning the Constitution and what rights we have right now. And I have to say that one of the most refreshing things has been seeing people saying, oh no, I'm going to my Constitution, I'm rereading it, I'm understanding it even more thoroughly, and I'm going to advocate for my rights and my children's rights.
No rights in Argentina. They had no rights, and they're paying a high price for it now.
That's really sad, and something that you definitely, with that story, enhance that when RFK gets confirmed, let's make it when he gets confirmed, and we're holding that in prayer, that this is not going to only affect the United States, but it will have ripples.
It will have ripple effects. And with the new president in Argentina, who is sort of a Argentine Trump, I think it's going to have an effect too.
Oh, yes.
Thank you. Oh, I see it affecting the whole world because as the United States of America, we send out vaccines to other countries. We send out vaccines all around the world that are hurting people, and medications, and our foods. So the U.S. influences the whole world. So we need to be a good influence and not a deadly influence.
Amen. We got to kick out the sad diet and make it a MAHA one. Thank you, ladies. God bless you. Would you like to make a statement? This is for Cafecito Break. I'm here with Michael Kane of Teachers for Choice and John Gilmore of Autism Action Network, and this is actually a package for him.
Okay, well,
What's your name and why are you excited to be here today?
I'm Rivera Douthit. I'm from North Carolina I actually came with these gals, but I'm excited for what RFK stands for. As a former nurse, I mean, I'm currently still licensed as a nurse, but I haven't worked for years because I don't really subscribe to all the medical end of things. I think there's a natural way God created the earth and ways for our body to heal itself. And the fact that people are so sick tells us that we need to be intervening with more natural ways of healing. And so that's really where I stand with all of that. And I just stand with RFK because I believe that if we could get some of the chemicals out of our food and stop some of these vaccine mandates and that type of thing and give people more choice, it would be a great place for us to be on the journey to health in America.
May that be so. Thank you so much for sharing your story. One more question. What was your pivot point?
What was my pivot point? Probably sickness in my own body years and years ago, but God healed me. I figured out some more natural ways of healing, and obviously just divine intervention. But so that led me more out of the medical end of things, and I've been in ministry for years because you know, when you're healed, and Jesus heals you, then you're just very vocal about that. And so that was a pivoting point in my life, and so here I am. I'm here to pray today and stand with RFK and stand with Health for America.
Amen. We need those prayers. Thank you, ladies. God bless you. Hello, hello.
Ay, Dios mío. All right, mi gente. I want to say that there are many people to thank. And the list is great and many. I haven't even thought about my personal list, but I want to make sure that I don't wrap out today without thanking all of the boots on the ground efforts in New York that contributed to this day. All of you that showed up in all of the events in Albany, to witness hearings, to hand out flyers, to raise awareness for children and their health in all facets. I'd like to say a particular thank you to the Freedom Fam and of New York, the New York Freedom Rally, Bravest for Choice, the Garvey 16, Curtis Cause, the GOD Squad, New York Du Jour, the Freedom Chariot Squad, all the indie media efforts, all the attorney, all of the OG activists that were paving the way for us to have this day. And to conclude, let's see the swearing in ceremony that we all missed one more time. So if you're tuning in now, we all missed it. RFK did get sworn in. It's official. He is our HHS secretary. So let's watch it one more time.
I, Robert F. Kennedy Jr. I, Robert F. Kennedy Jr. Do solemnly
Maybe we're not going to watch it with sound because yo no estoy escuchando ningún sound. And that was a big miss. All right, let me see if I could share it again, guys. Uno está haciendo things live and in living color. Esto a veces pasa. Oh, now I know what I did. No, no estoy escuchando una. All right, stand by, guys. I definitely want to wrap up with the swearing in ceremony one more time. I think that my shared screen was muted. Cuando uno está haciendo things live, it gets a little sloppy, guys. Sorry about that. We're back to cafecito break. Thank you for everyone who has subscribed. Appreciate that. All right, this is going to play. All right, mi gente. We're going to wrap out by seeing the swearing in ceremony that we were all waiting for and that we missed because it happened already. But it is official. Robert F. Kennedy Jr. is now our HHS Secretary. Congratulations, Mr. Kennedy.
I, Robert F. Kennedy Jr.,
I, Robert F. Kennedy Jr.,
do solemnly swear
do solemnly swear
that I will support and defend
that I will support and defend
the Constitution of the United
the
States
Constitution of the United States
against all enemies,
against all enemies,
foreign and domestic,
foreign and domestic,
that I will bear true faith and allegiance to the same,
that I will bear true faith and allegiance to the same.
that I take this obligation freely,
I take this obligation freely
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion,
and that I will well and faithfully discharge
and that I will well and faithfully discharge
the duties of the office
the duties of the office
on which I am about to enter,
on which I'm about to enter,
so help me God.
so help me God.
Congratulations, Mr. Secretary.
Congratulations. Thank you, everyone. Love you guys.